I would like for you to agree that it is vital for a child to be vaccinated. It is vital for a child to be vaccinated because vaccines help foster early childhood development, help protect other people by aiding in a herd immunity, and aid children as they are combating illness. I didn't put much thought into vaccinations until I gave birth to my daughter last November. I was then awakened to the world of pro-vaxxers versus anti-vaxxers. The pro-vaxxers informed me that if I didn't vaccinate my child that she would die, and the anti-vaxxers informed me that if I did vaccinate my child that she would die. I did my own research and found myself on the pro-vaccination end of the scale. I most definitely have good reason behind this stance. My daughter has been sick off and on through the first year of her life. If it wasn't for vaccinations, I feel like her sickness would have been elongated and she wouldn't be with us. Many anti-vaxxers believe that we do not need doctors or modern medicine. I totally and utterly disagree with this because I cringe to think of the diseases that would still be floating around and claiming lives if it weren't for vaccinations to prevent them. We might all be walking around with the flu, measles, mumps, and whooping cough if it wasn't for vaccinations. This brings me to the question: if you knowingly had the option to prevent these fatal diseases and save your child's life, would you do it? I'm sure that most of you, if you're normal, answered yes. But if you didn't, because you are, in fact, a part of the anti-vax party, I'd like to convince you otherwise. Please listen along as I begin to list reasons and information as to why you should vaccinate your children. First of all, one reason as to why you should vaccinate your child is that vaccinations aid in early childhood development. The most important years that represent early childhood development are from 0 to 3 years old. One of the most important factors to a child developing mentally, cognitively, and emotionally can be based on how healthy the child can stay. According to 0 to 3 website, poor health in a very young child can have negative impacts on all other areas of development. Therefore, vaccines are necessary in aiding sick children in fighting off common diseases that could cause diversion in development. Another reason why children should receive vaccinations is because it allows them to aid in herd immunity, also called community immunity. Herd immunity is possible when a community takes action in getting their children vaccinated. According to Nancy Messonnier, when a critical portion of a community, such as a child care center, is immunized against a contagious disease, most of the community are protected against that disease because there is little opportunity for outbreak. Herd immunity doesn't only protect the child that is able to receive the vaccines, but it can also help those who are ineligible to receive vaccinations, such as women who are pregnant or those with compromised immune systems, and infants. Last but not least, vaccines have historically helped children in fighting off diseases that are detrimental to their health. Vaccines reduce the risk of infection by working in the body's natural defenses to help it safely develop immunity to disease. Jonas Salk discovered a vaccine for polio, which is penicillin. Today, polio is the next disease close to total eradication, followed by smallpox. According to PNAS, a recent analysis of vaccines to protect against 13 diseases estimated that for a single birth cohort, nearly 20 million cases of diseases were prevented, including over 40,000 deaths. In general, vaccines help to cover almost 14 different diseases. At different times throughout history, severe outbreaks of rare illnesses will occur over the entire nation. However, in most public sectors, common outbreaks will occur annually. Parents should give their children a chance to withstand disease by providing them with vaccinations that will help when outbreaks occur. Although the population of those who choose to reject vaccinations is less than 1%, there is an extreme risk of this number inclining if the proper precautions are not taken by primary care physicians. According to Mark Duchman, lack of communication of vaccine information is an identified barrier to immunization in the United States and internationally. When providers do not have a reliable source of information about a child's immunization history, screening efforts become difficult and frustrating. The conversation towards whether vaccines are necessary is one that is considered hot on the press. I firmly believe that in the grand scheme of events, vaccinations are very necessary because they embody early childhood development, aid in protecting the community as a whole, and are effective in helping children fight against diseases that could be essentially harmful to them. Thank you for your time.